Good morning, afternoon, or evening. I'm not sure when you are watching this video. I'm Paulin, Basinga, the Director for Africa at the Gates Foundation. I want to thank Malaria No More for inviting me to speak at the Forecasting Healthy Future Summit today. I wish I could be there in person with you all. This summit provides the unique advantage of convening the climate and health communities. Really great to see scientists and doctors and policymakers and passionate advocates all together coming to address one of the greatest challenges humanity has ever faced. This challenge does not affect all of us equally. Climate change is already catastrophic, showing catastrophic consequences on the health and food security and economies of the poorest country. Consequences that will only continue to get worse if we don't act quickly. At the Gate Foundation, we strongly believe that those who have contributed least to our changing climate should not be suffering the most. That's why we're paying close attention to diseases like malaria and dengue that are spreading as warmer temperature bring the mosquitoes that transmit them to new geographies. And extreme weather events like floods drive more outbreak and disrupt our ability to respond to these surges. The predictions are alarming. Between 2030 and 2050, climate-related health risks could cause an additional 250,000 deaths per year from malaria, diarrhea, undernutrition, and heat stress alone, most of which will occur in sub-Saharan Africa. This is an unacceptable injustice, and the reason the Gates Foundation is so focused on ambitious health targets that will avoid this climate-driven surge in death. For diseases like malaria, which alone could claim an additional 60,000 lives or more annually, if we don't act, that means eradication, which could be one of the highest return investment to mitigate health impact of climate change. To get there, the Gates Foundation is investing in next generation vaccines, innovative vector control tools, surveillance, and advanced monitoring systems. A malaria-free world that has the potential to save hundreds of thousands of children from preventable death each year, it's possible. With the right tool, investment and coordination, and putting government first and working collectively, we believe that the world can achieve this goal. Unfortunately, despite sub-Saharan Africa accounting for only 4% of global greenhouse gas emission, the African farmers are facing losses that are almost twice the global average. This is so unjust. Only a very few small percentage of climate financing globally goes towards supporting those smallholder farmers in sub-Saharan Africa. We believe that small-scale farmers are the foundation for developing resilient, equitable, and sustainable food systems. That's why one of the ways in which we are working to minimize the impact of climate change is supporting innovation, like giving smallholder farmers early warning system and new digital tools to access technical advice and markets that help smallholder farmers to better predict climate impacts on crops and leverage data to boost food security. Increasing investment in agriculture innovation will ensure that smallholder farmers across sub-Saharan Africa and South Asia have the tools they need to embrace new practices, sustainably grow more and healthier food, and adapt to climate change. There is a reason for optimism in a healthier world. I'm greatly encouraged by the growing global momentum behind climate health initiatives. I'll mention two that happened from last year and this year. COP28 marked a significant turning point. The COP28 Declaration on Climate and Health that was launched on the first ever Health Day at the annual convening demonstrates a global commitment from 150 nations to address the increased health and threat by the environmental shift that we are seeing. And then only last month in Geneva, during the World Health Assembly, an historic resolution on climate and health was unanimously adopted by all 194 member states. This is really great. I think what we need to do now, we must urgently turn this vital commitment into action, prioritizing the area of greatest need and addressing them with the interventions that offer the highest potential for impact. Looking ahead to COP29, the need for robust funding for climate adaptation and global health has never been more critical. And I'm glad that this is something that is top on Azerbaijan's agenda. I look forward to seeing the country's continued leadership in prioritizing health and human development outcome at COP29 later this year. One of the best ways we can protect the health of both the planet and the people, especially the most vulnerable, is through innovation. Whether that is providing smallholder farmers with the data to boost their food and nutrition security, or deploying innovative new tools to end malaria, or even finding new innovative ways of implementing programs faster in a more cost-effective ways. With cutting-edge, transformative solutions, we can not only address these challenges, but also build a more resilient, healthy future for all. I thank you very much.